we're looking at residential treatment as one of the realms of possibilities for that adolescent. We're really looking at the severity of the symptoms of the adolescent. So, when we find that the symptoms are severe enough that they're impacting many areas of functioning for the adolescents, there's also risk for further deterioration. Um, we now are in a place where we have to seriously consider what level of intervention is important or necessary to make sure that this use doesn't continue to devolve and symptoms get worse. We want to be able to give them an opportunity to pause all the things that are impacting them, put them into a safe environment, have them go into a safe environment where they can get round the clock care. So there's a continuous reinforcement of not only all that they're learning, but all the emotional supports that are being put in place through the programs. When they're able to experience something so vastly different from what they've typically been able to experience, what we find is that a lot of adolescents start to become more responsive to the training they're receiving on coping skills, to participating in the processing of the challenges going on in their life, and feeling oftentimes more safe to be able to explore what's happening internally for themselves. So it is when we find that these symptoms are so intense for the adolescent that we realize that they actually need a moment to step outside of the things or away from the things that are deeply impacting them and give them a chance to breathe essentially. It's with that breathing that they have a moment to really like learn, to really take in what's going on, to process and understand themselves deeply. And then eventually we slowly move them towards gradual reintegration back into community, into their families and friendship circles. But they had at least a significant amount of time to really take in all the learning and then skilled application and processing.